I haven't got the screen share invite yet, FYI.
Yeah, they need to get that. While they're doing that, welcome back, everybody, especially those that were with us all morning, and welcome too for those that may be joining us now. Our next panel is the future of transportation post-COVID transit service. Big issue. I think we all understand what's going on right now, and we thank you for joining us. First, the panel will be speaking on challenges that transit services are facing, operational changes that have been made for both safety of riders and operators, changes in demand for services, and changes still to come. We will hear a statewide perspective from Justin Layton, Executive Director of the Washington State Transit Association. From Two Transit Systems, Hannah McIntosh, Recovery Planning Team Lead for King County Metro, and Richard DeRock, the General Manager with Link Transit in Central Washington. And Russ Arnold, Chief Customer Experience Officer, Sound Transit. And we're going to lead off, I believe, with Justin.
Yes.
Justin.
Thank you. Can you see the screen?
Yep.
All right. I'm going to minimize. So thank you very much. I appreciate the opportunity to present today of a statewide overview, perspective, and what I would offer of what little we know about what's next. And so just trying to hit the response impacts and some moving forward, going from there. There we go.
One quick thing, if you want to change that to a full screen view.
Yeah, it is full screen on mine. I just want to make sure.
There we go.
There you go.
There we go.
Got it. Thank you.
Yeah, no problem. There we go. So I'll touch a little bit on COVID-19 response impacts and moving forward from a holistic point of view of transits in Washington State. Well, I'll let my member agencies touch a little bit more on the local impact and how you will see from the variety of transit agencies that are presenting after me how each one is nuanced. Not every community is the same. Just a little bit about WSTA. WSTA is a statewide organization. Our mission really focuses around public education and outreach, advocacy, both at the federal and state level to push for public policy that effectively works for us. And we do quite a bit of work in fostering the collaboration and professional development of public transit agency employees. And you'll see a little bit of what I mean by that and how we have been helping during this crisis. We were formed in 1981. 31 transit agencies are members, including Washington State Department of Transportation. Our largest member is King County Metro, who is on the panel today, to our smallest member of Garfield County Public Transportation. Combined, WSTA members provide over 240 million annual boardings, and their combined service area covers a little over 86% of the state's population. So a little bit about the response, and it's really hard for me to get into the nuance about every little thing, but some of the broad responses, a lot have been talked about in the public. About fare free and daily spot cleaning, daily full cleaning and spot cleaning. You might have heard a lot about the rear door boarding, driver barriers. There was a reduction in service, balancing between essential and non-essential riders, pandemic leaves, and food and medicine delivery. So I'll just touch a little bit about each one of these. Buses were never really cleaned every single day until now. And so every agency is cleaning, deep cleaning, spot cleaning in between the routes, and so on and so forth. And so I think it's important for those who might not take transit often to know that transits, not just in Washington State, but across the country, are really taking this seriously about fogging their facilities and cleaning their buses. Fare free went into place because really for two real good reasons. We wanted to try and move passengers away from the driver to protect the driver. And as you know, Farebox is at the front of the driver. And then a lot of agencies are still using coins and papers. And so going fare free actually just cuts down on the actual things that we need to handle. Once that money goes in there, it comes back to the base. You got to count it. You got to take it to the safe. You got to take it to the bank afterwards. And so just cutting down on those things. I'll talk a bit about what going fare free means statewide from a revenue point of view. Rear door boarding, for those vehicles that allowed so, we pushed all passengers except for ADA passengers to rear door boarding. And again, that just really drove the passengers away from the drivers to protect our essential drivers. We saw quite a few agencies right out of the gates and try to develop driver barriers. I'll talk a little bit about Clallam Transit in a second, who were one of the first agencies that began installing those driver barriers on their buses that don't have rear doors. I think it's important. I think a lot of folks just see the big bus in downtown Seattle or through the Central Puget Sound, and they're 40-footers or the articulated buses, but a lot of agencies around the state have shorter buses. They're 30-footer. They only have one door boarding in the front. So getting those driver barriers up quickly on those smaller buses without rear doors is really important. Reduction in service levels was really because we just had empty buses running around. Now, the Federal CARES Act, which I'll talk about in a minute, really provided funding to continue paying drivers even if they weren't riding the bus. And we're starting to see some service levels pick back up. We'll talk about ridership in a minute and what that means. My point about balancing between essential and non-essential riders really is about what we knew, and I think a survey was done by one agency that showed through the pandemic, most of their riders were essential. But we did see quite a bit of folks just riding around the bus when it's fare free. So we call them non-destinational riders. And so we really tried hard to ensure that we were communicating as a transit industry, please only take the bus if it's an essential trip, you're an essential employee going to an essential job. A lot of agencies implemented a pandemic leave, paying their drivers more to go through this. Then food and medicine delivery, some folks may not know this, but agencies begin doing, and through the FTA's funding and approval, delivering food and medicine to people's doorsteps. So instead of the person getting on the bus and going to a food bank or going to the pharmacist, the reverse happened. So back to the Clallam Transit and our message is to home. So whoever is not talking, if you could put yourself on mute, that'd be great. Thank you. So Clallam Transit, there's a picture right here on your screen. It's really hard to see, it's a little dark, but these are actually not, purchased on a national level. They had a local person come make a template, and then they started beginning these just out of plexiglass and building them themselves, and installing those driver protector barriers on their buses without rear door boardings, and then they have moved into doing that all. We're seeing across the nation driver barriers being installed. Really, you only saw this in areas of the country having driver barriers to protect against violence, not necessarily against pandemics or the flu or something like that. And then, of course, it's actually pretty against our intuition to encourage people to stay off the bus. But in this situation, transit needed to be part of the solution, and to try and limit folks just riding around the bus without essential trips or without a central destination. We really communicated that we really only wanted to see passengers that were on the bus, essentially. So here's an example of a reader board. I had to play it a couple of times. You can kind of see stay home, save lives, essential trips only. Again, this is against everything that we know and believe in, is to discourage ridership. And so it took quite a bit to do that. From a perspective of our role in this, WSTA helped deliver over 130,000 face masks, both N95 and surgical masks, to 40 transit agencies in 3 different states. Fun fact, WSTA actually has 4 transit agencies that are members outside of Washington, 1 in Montana and 3 in Oregon. And so at the beginning of this, we all saw it. PPE was not available. It was very difficult for agencies to find it. And this isn't any slant on the state, but the state was not helping, and the federal government sure was not helping. So WSTA took this into our own hands. We found a provider. Actually, it was a bus maker who turned one of their plants into a PPE factory. We were able to buy in bulk. Again, some of our agencies are really small. They don't need 20,000 face masks. They might only need 1,000. And so we were able to buy in bulk. My staff and I spent several days delivering these around the state and into Oregon for that, to provide not just our drivers, but also our passengers. A lot of agencies were buying masks so they could hand out to their ADA passengers who may not have a mask, to give them a mask to board. We hold weekly calls with our small and mid-sized transit agencies. They have a unique way that they need to respond, and so they talk amongst themselves about issues that might come up. Right now, as you may know, the governor is having everybody wear face masks, so we're trying to figure out what that means for riders. What about riders who want to refuse it? What are we supposed to do? So these calls have been helpful. We hold frequent meetings with our department managers for our HR committee, finance, operations, maintenance, and marketing, and general managers. In fact, our operations managers are having one of their meetings as we speak. And so when I'm done here, I'm popping back over there to check in on them. And WSTA is serving as a clearinghouse of resources. On our website, we try and collect helpful information, digest it, put it in categories, and then behind the scenes, we manage a folder of other resources that our transit members have access to, whether it's sharing press releases, sharing leave policies, and things like that. And so we have over 300 documents in that folder that we have been managing and working on as well. The impacts, I'm just going to touch a little bit on the ridership, fare box revenue, sales tax, and let King County, Sound Transit, Link Transit talk about what it means to them and their community, and so on and so forth. The impact was swift. It was rough. And so this was actually a graph I put together at the end of March. WSTA is pulling together the data. I know it was talked about before, the governor's dashboard. So WSTA put together the intake, and that is what the governor's office is using to report out from WSDOT. And so we're able to see from the 10 agencies that we started collecting here what ridership looked like in just March. It was a 75% decline. I put some timeline notes in here from the point of where Governor Inslee declared a state of emergency to when schools were closed, and when the stay home and stay healthy order was put into place. Since then, we have actually started collecting data on all transit agencies in the state. And so this is what that graph looks like. So starting from March 1st to the end of June, this is what transit ridership in Washington state looks like. As you can see, we hit the rock bottom on April 23rd, which was the day that ridership stopped declining, and we hit a 76% average decline. Now, again, a lot of agencies are different. Some agencies didn't see that much of a decline. The Central Puget Sound area which was the first to go into lockdown, saw the greatest hit. Intercity transit actually converted their entire system into demand response, where you had to call ahead of time. And so their ridership decline was in the 90s. And so what we need to think about is that while ridership is now starting to grow, it remains anemic, and also is not coming back in the same levels that you see with ferry ridership, with vehicular traffic as well. Something that we need to be thoughtful about. And that has a lot to do with messaging, that the bus is safe, that it is okay to ride the bus. And that is not just transit's job to message that, it is the job of every elected official, the governor, WSTC, the community, our boards, and advocates to say, riding transit is okay. One of the things that we still need to think about is, what about the second COVID wave? In fact, I would even offer we're not even done with the first one. What is that going to mean for ridership as we go? What is that going to mean for transit? And I know that that is a central focal point of our discussions today. As part of keeping drivers and passengers safe, nearly all agencies went fare-free in April, as I talked about. So this is the statewide fare box recovery decline. As you saw in March, it really started to impact agencies, but really the heaviest hit was April, May, and June. But I do want to make sure that we know that fare box revenue makes up only a fraction of the revenue for transits. The real issue for our revenues is sales tax. Transit is 70 to 80% dependent on public or on sales tax. We get very little money from the state and from the federal government. Most transits survive on fare box and sales tax. So I broke out the Central Puget Sound versus the state. In March, we saw nearly a 25% decline in the Central Puget Sound versus a 17% decline statewide. And then in April, we saw an 18% to 11%. Now, what I want to point out is a couple of things. 2 data points a trend does not make. And just because one metric is better than the last time does not mean the system is improving. We don't know a lot of things right now about sales tax. I have been a voice that continues to say, slow down, sales tax is going to have to be looked at over time. In April, most people got their $1,200 checks from the federal government. So did we actually see the increase there? The other problem that we have with sales tax, and you've heard Secretary Millar talk about it and the forecasters, is there's a lag in information. So we get sales tax reported to the agencies 2 months after it's collected. So that's why we have no information about April or about May. We have no information about June either. The federal government did act quickly. I mean, for all intents and purposes, for those who have worked with the federal government legislation, it can take years to actually get something that you are advocating or want. But in the CARES Act, transit actually was well taken care of for the first part. And I want to couch that in the sense that relief is still needed moving forward. Washington State saw about 800 million of the 25 billion that was in the CARES Act come to our state, where 500 of that went to Central Puget Sound Transit, 100 million to other urban transits like Spokane, C-Tran down in Vancouver, Whatcom and Ben Franklin Transit in Tri-Cities, and then there was 44 million to the small mid-sized transits and tribals and nonprofits. What's important, and I heard a speaker last week talk about the change in the way the federal government gives money, and I sort of took heart to that because, or took offense to it, because this federal CARES Act money was, one, it was relief, it was not recovery. It's very important to say that this money was not stimulus or relief or recovery money. It was strictly about helping the right now. There was no match needed, 100%, which is rare for federal money. You can start using for any expense going back to January 20th. and there is no deadline for the use. That is very rare for these funds. For the most part, outside of some of the kind of the larger urban areas, this federal money is starting to look like it might be helpful to cover 2020 losses in our revenues. But still in the Central Puget Sound, you see deep cuts about what revenues will be lost. Moving forward, I just, I am not one to predict about where we're going here, but there's a couple of things that we need to kind of think about. There's conflicting needs, service levels versus social distancing. Because of the social distancing requirements on the bus, we have less capacity. And that means that if we want to move more people, we have to add more service. Adding more service means hiring a new individual. It might mean buying new buses. And so that increases the cost of delivering the same level of service in a depriving resource time. Again, we are having conversations about response versus recovery. I throw caution to the wind. The pandemic is not over. We just heard Governor Inslee come out that he's putting a pause on the reopen. We have record-breaking cases happening around the country. And we should caution ourselves to begin redefining what transit or transportation looks like in the new normal. You don't clean up the front yard in the eye of the hurricane. And what I mean by that is we can start learning from this. We can start making some assumptions and tracking, but I don't think that we really know what behaviors are going to remain in place or go back to what they were before. And then, of course, relief and recovery funding. Funding will still be needed to continue providing relief. Transit can be part of the critical to open the economy and recovery, but this is going to be both federal and state to help fund this. During the Great Recession, there was funds called ARA, and transit agencies were able to pick away at a lot of their capital needs, shovel-ready projects. Transit is ready for that, but we also still need some relief funding. And that's my short and sweet presentation. Happy to answer questions after this or individually as we go. Thank you.
Thank you. I think we're going to hold questions till the end. And who we have? Hannah McIntosh, you're up next.
Sounds good. Let me get my screen shared here. Let me know when folks can see it. I'm seeing nods. Okay, great. Let me get this in full screen. All right, is it in full screen?
Yes.
Yep, okay, perfect. So thanks for having me here today. Again, I'm Hannah McIntosh. My name is Hannah McIntosh, and I am here in my capacity as the lead of King County Metro's recovery planning effort. That effort is really a two-pronged effort that we are in the middle of, where we're focused on making high quality and rapid decisions, really in a state of emergency context, and then also at the same time, trying to turn our attention forward and plan for what the eventual rebuild of our service and our system will look like. So a lot of what I'm going to say is going to be parallel to what Justin just shared. That was great. I will try to be efficient and not repeat a lot of what you heard from him, but I do want to share with this group some of the unique impacts that COVID has had on our agency, how we've responded, and then a little bit of our early thinking about rebuild and what that rebuild process will look like. So the impact. And why are we talking about recovery planning? So when we talk about the crisis at King County Metro, we really talk about a threefold crisis. There's obviously the public health pandemic caused by COVID-19 and the economic recession that is coming with that and will linger after it. And then in parallel and worsened by the public health crisis is a national reckoning that we're having and around racial injustice. sort of a pandemic within a pandemic. I imagine many of you are familiar with that terminology. And in the midst of this, we need to start planning for what it's going to look like when we move out of this crisis and how we will rebuild toward our long-term goals and really center our key agency values of equity, safety, and sustainability in our response and our recovery. So a little bit about the disproportionate impacts of COVID in King County. You can see, this is a map of King County here, and you can see that the COVID-19 rates per 100,000 people really vary by race. And you can see that data on the slide. And then I think we've also seen, and we've all had to kind of take stock of the fact that when we've realized who keeps our society moving, who stocks our grocery shelves, who keeps our ER rooms open, who keeps our electricity on and our water flowing, our essential personnel are more likely to be people of color. They are more likely to be low income, and there's actually a gender split there too. They are often more likely to be women. The early measures taken to slow the spread, this group is probably more familiar with these than many other groups, so I'm not going to spend a ton of time here. But there are specific ways that those measures have impacted King County. You can see the chart or the map on the right-hand side of this slide where we've lost the most and the least ridership from the pandemic. So routes in blue show where ridership, those are the routes that are in the top 10% for ridership decline. And if you're all familiar with kind of the demographics of King County, you're probably doing the calculation in your heads right now. The routes in blue tend to serve communities that are higher income and whiter than the rest of King County. Not totally, but in general. And then the routes in yellow tend to be almost universally our 100 series routes, and those routes serve South King County, which is generally more diverse and on average lower income than the rest of King County. COVID has also impacted our employees. We have all of our office staff working from home. We have already put into place reductions in force that just started last week, and that will continue. It's a hard week at Metro, honestly, for that reason. And then all of our employees are grappling with what I'm sure many of you are grappling with, is how on earth you function as a professional and school teacher and a daycare provider. So just a really strained and stressed workforce right now. COVID has changed travel patterns in King County significantly. So obviously overall demand is reduced. Peak period demand is especially reduced. On average, our ridership, I think at the very worst of the stay-at-home order, had declined 80%. We are back up to between 30 and 40% of our normal ridership right now. We did run a reduced schedule until late June, and we are now not on that, hugely reduced schedule anymore. That chart was just year over year weekday ridership. And then obviously this has financial impacts for our organization. So even before COVID, we were facing a 10-year budget shortfall of about $1 billion. And the CARES Act funding has been huge. That has allowed us to keep going in the last couple of months. And then I am very grateful for some prudent financial planning that we have a pretty healthy revenue stabilization reserve that we're also drawing on to cover unexpected costs. But even with this, we are looking at about a $2 billion deficit through 2028. So a really significantly changed financial future for our agency. And then what have we done to respond? Obviously, safety has been first and foremost. So a lot of what Justin talked about, we've implemented. Fares are still suspended on King County Metro. They are suspended at least through August. And we are working now to put a plan together for a safe resumption of fare collection starting in September. So that planning is in the works. We're doing a lot of the cleaning, the providing PPE that Justin talked about. We have also put in place capacity limits on our buses. So for a 40-foot bus, 12 riders, and an articulated bus, the longer 60-foot buses, 18 riders. It depends on the bus, but this is about 20% of a bus's normal capacity. And when the bus is full, the operator is authorized to pass people up at the curb. So that has led to a very inconsistent customer experience and has been a challenge. We are requiring masks on our service. We have been able to partner with community organizations to help distribute masks to riders who may not have access to them other places. And then this is all just the public facing part of transit, but there's a whole universe behind the curtain. And so we have a pretty extensive set of facilities, bases, vehicle maintenance facilities, component supplies facilities, where we have had to really rapidly put in place new practices around physical distancing and cleaning. And so that has all been happening as well. Service changes, we talked about this a little bit. We were forced to reduce service 3 times in March and April, and that was primarily in response to workforce shortages. So we had quite a few of our frontline staff needed to, either because they had underlying health conditions, they were tested positive for COVID, or they had childcare responsibilities with schools closed. So we had quite a few employees out on leave, and we did need to reduce our service. So the bus is what people quickly associate with King County Metro, but we also operate the Seattle streetcar. We partner with our friends at Sound Transit and operate the light rail trains. We run the water taxi and then a whole range of other contracted services, and all those saw reductions. Also, our van pool and our access service had to change to be sure we could keep physical distancing in place. And then the last bullet, Justin touched on this, we definitely engaged in some brand new partnerships around distributing food as part of our transportation for pandemic response. And I love King County Metro. I love working there. We are a giant bureaucracy. You know, we're a 5,000 person organization and we do so many things so well, but moving quickly is not always one of them. And we have had to learn to move very quickly. We've had to learn to exercise muscles we didn't even know we had to do all of these things. So service today is at about 85% of pre-COVID levels. That allows for that lower capacity on our buses, extra space. We will be making service cuts this September, next March, and the September after that because of our new budget realities. We're working hard to engage our community around those cuts. You all know we're having this conversation on Zoom, and talking to community is harder now and it feels different, but we're working hard at that. This is just a little bit more about how we've engaged. I think talking to our own employees is also more challenging right now, especially our, over 4,000 frontline staff. Communication often works best verbally. Long emails aren't always a very effective way to communicate, and that's hard. We've worked hard to figure out how to do that in this new world. So I do want to really echo what Justin said, and I appreciated that we're actually having an internal conversation about not even using the word recovery because we're not there yet. We do not understand the full extent of this crisis or the full extent of the impacts on our agency. That said, I think it's our responsibility and our charge to also be able to look forward. So we have done some early thinking about what a rebuild process might look like. Our vision is that we think public transit is at the heart of a successful community and a successful economy, and it will be a bellwether of a successful recovery as well. As an agency, we want to emerge from this more resilient and more equitable and really grounded in our values of safety, equity, and sustainability. And so what does that look like? We have some early thinking here around our goals for recovery. Obviously, safety, top of mind always. I'm proud that we've been able to be a national leader in conversations around how public health guidance applies to transit, and we will continue that. This is an opportunity we've also recognized to better align our practices with our values, especially around equity. We have a great set of core values. That doesn't mean that always our practices or our structures were effective for our employees or for the public, and this is a chance to build back in closer alignment with those values. We spend a lot of time talking about ridership losses. I am also amazed at how many people have stayed on our system. Over 100,000 people every day, 150,000 now, are still riding King County Metro. And they need us and we need them. And so they will be at the heart of our recovery, those people who never left the system. I think we've learned a lot about being a more nimble and flexible and adaptable organization. And so we want to leverage that and build on that. And then this group understands probably even better than most the importance of transit in the future economic recovery, that everyone cannot return to single occupant vehicles. So great segue here. Transit really is a tool for environmental justice, and it will be a key part of a climate-friendly recovery. I think we've covered most of this. I really like this quote that in a pandemic, we are all transit dependent. So how will we get there? These are principles for recovery planning. A lot of this I've talked about now. Part of it is walking this tightrope of planning for the rebuild, even as the crisis is still unfolding and we're still responding to it. And for those, some of you on the call, I think, know that before this all happened, Metro was in a multi-year process to update our policy documents, and that is still ongoing. And so the work that I'm leading is we're in really close coordination with that policy update team. And one of our criteria for any recovery action is that it has to be in alignment with and pointed at our eventual policy update. So in a sign of how quickly everything is moving, these different scenarios, when I submitted this presentation, I think a week ago, seemed very current. They're not anymore. So I think what you see on the screen is a really high level look at what, at this point, I would characterize as the most optimistic scenario that we're planning for, where we are in crisis now. There's a slow but steady recovery, possibly, with interruptions as the virus starts behaving in ways we wish it wouldn't, but, and where that recovery gets interrupted, and then a vaccine at some point next year. I think, again, this is probably the most optimistic of the scenarios that we're planning for. And we're still in the midst of this and it's still unfolding. The format of the plan, for anyone on the call who's a planner, it's going to be very tactical, very action recovery response and recovery focused. We are looking at a 12 to 18 month planning horizon. That may change as we learn more about recovery scenarios that we need to reflect. There's a lot of good thinking happening both within Washington State with what Justin shared and around the country. So a lot of peer agency lessons learned for us. And yeah, I think I talked about the policy update. So this is just where we're headed. I think we've covered most of this. The crisis will continue to unfold. We'll continue our emergency response. And then we'll also develop this rebuild and recovery action agenda. We're targeting September for that, and probably it'll be something that comes out in concert with our budget transmittal. That's our thinking right now, is that will probably in September. We will be engaging with stakeholders and with community and our own employees through the summer to help build that. And I don't think there's time for discussion, but if there is at the end, I'd love thoughts on this question. All right.
Thank you. Hopefully we'll get some questions and have some time at the end of all the presentations. Richard DeRock is the next one up. He's General Manager at Layton Transit and in the Chelan Douglas area. And good to see you again, Richard.
Yep. Great. Can we bring the presentation up, please?
One moment, please.
There we go. Great. You can see the title is an existential crisis, and I think that really is probably the key word on what's going on in transit. I've been in transit for 39 years, and nothing like this has ever happened. So let me set the stage for us at Link Transit. Now, we're unique. We passed a sales tax increase in August. It went into effect in January. So we had a new revenue source coming in at the beginning of this. Now that was to prepare for a 22% service expansion in July, which was going to be better Saturday service, first time we've ever operated Sundays, early and later service. Beginning of this year was extraordinary for us. Our average ridership was up 6.1% in January, set an all-time record for January in our 30 years of history. Our February ridership was up 16.2%, highest daily average in 20 years. And prior to 20 years ago, we were fare free. So the fact that we set a ridership record with fares was pretty amazing. And that record ridership continued through the first couple of weeks of March. Even though, things were not feeling quite right, people continued to ride. Next slide, please. We did see some early signs that things were going wrong. Our sales, we did a 2-tenth sales tax increase, 1/10 effective January 1st, 2020, a 2/10 effective January 1st, 2022. So we phased it, but the first one went in January. That was a 20% increase for us. Our January sales tax collections were down 10.3%. We were over 14% from last year, but it should have been over 22%, where it should have come out to being. So we're like, okay, something's not quite right. February was a little better than what we had thought, than where we were. It was closer to what we had estimated, but it still was not as positive. We've been coming in significantly ahead of projections up until January. Next slide. March, I think the graph shows the picture. Ridership was pretty solid the first 2 weeks of the year until the governor's order came through. And the initial one, we were a month behind King County and Puget Sound on the shutdown orders, but we fell relatively rapidly after the 18th and continued to drop. Now, we didn't drop as bad as a lot of areas did. Our worst drop in ridership was we fell to about 59% below where we had been. And that was kind of a surprise. Next slide. So when the ridership collapse happened, some of my board members said, why are we operating? And I said, well, who do you think's riding? And they said, they didn't know. And so I had to go, I went out and did some work to sort of prove them. Essentially, what we had is our riders are our essential workers, which is our fruit processing facilities, which of course are the most heavily impacted with COVID, but that's a whole nother story. Medical housekeeping. Wenatchee is a medical center. We do, I think 90% of all the medical care in Central Washington, North Central Washington is done in Wenatchee. And so we have a lot of facilities and a lot of people in those areas. And Our Central Washington Hospital, 80% of their people that do the cleaning in the facility ride us to work and don't have alternatives come in. We also have a very large senior population and a lot of group senior homes, and almost entirely those people are riding the bus to and from work. So a very similar situation. And then our grocery stores, we have 7 of them in the Wenatchee urban area, and we chatting with them, said half of their employees are dependent on transit to get to and from work. So that really was a big part of it. We were surprised by the number of people who were riding every day, and we started trying to figure out what was going on, because they weren't going to work, but they were going to dollar stores to buy their groceries. And they're so low income, they're paying cash on a daily basis, and that's where they're buying their food. And that was a surprising result. It's like, okay, that is critical, that is essential. You didn't really realize that was what was happening when these people were going to these super discount places. Persons with disabilities without choices, and then the homeless displaced population absolutely is out there. Although we didn't see an increase in that category when we went fare free, which we did in the middle of 3rd week of March. Who did we lose as our riders? Well, when the college shut down, we have a pass program that cost us 500 rides a day. Government shut down. We had to get agreements with all the cities for passes. We lost all our governmental riders. School kids, inter-district transportation is significantly on the transit system, and all the private schools use the transit system to get around, so we lost all those folks. The stay-home order, of course, cost us the office workers. And Chelan and Douglas County are very heavily hospitality-oriented, and the hospitality shut down entirely. And so that was a huge hit. And then again, we're a medical center, but no medical appointments. So people accessing the medical center stopped riding. And then the people that have choices. I mean, to the most part, we're talking about people who don't have choices are the folks riding the bus today. Next slide. Our ridership has been actually doing better than I think a lot of people have expected. We're now at 39% below where we were in same time last year. It's still essential riders. We implemented masking on the vehicles, 4 weeks ago, whenever the order came in. Like has been done elsewhere in the transit world, we got PPEs. We worked with WSTC for supplies for our public. We actually had the community came forward and we had sewing circles in a whole bunch of communities that actually produce 4,000 masks we distributed in April in the community. So that was a really positive piece coming out. And for the most part, we distributed them to our fruit warehouse workers because that's where we're seeing the spikes in positive testing. Let's see. Go to the next slide. Next slide, please. Thank you. Sales tax. This is the existential crisis. You've lost your riders, you lost your revenue source. There's 2 lines on this chart because the orange line would be on an equivalent basis to last year. Our sales tax went up 20% in January. So using raw numbers it's good to tell us where we're at, but effectively to say what the impact was, our sales tax is down an average of 25% from last year on an equivalent basis. Now, because we increased the tax, we're actually only down about 8-9% in actual cash collections going forward. But again, we had promised that additional money to pay for additional services. So it sets us up in an interesting situation at that point. And on the east side of the mountains, our sales tax loss is higher than any other systems on the east side of the mountains. And that was a little surprising, particularly for the neighboring counties. Grant County, which is right next to us, they're barely down in sales tax collections. And going, so what's the difference? Well, a third of our economy is tourism, and that's just died. And so that's a big chunk of where our loss came from. Next slide, please. So impacts to us. Well, enhanced sanitation, additional staff and supplies. We've been doing actual sanitation of the equipment since 2009 when the H1N1 virus came through. We adopted sanitation strategies at that time. We just kept them. And so we didn't have to do a lot more. We already had the equipment. We already had the sanitizers for the buses. We just had to add more staff to do it more often. So rather than doing it every night, we're doing it twice a day. And I'm not sure how effective that is, but it's also a good message to the public doing that. We did eliminate fare collection, and the board's actually going to vote next week whether to keep it suspended through December. Our thought on this was we could go back. We now have installed driver shields. The fare boxes are outside of the shields, so we could collect fares. But as we looked at our policy, we still have day passes, which require the driver to hand a pass to someone. We still have pass validation, which requires passengers to get close to the operators, and said, with the policy we would go back to, it doesn't really work if we're trying to keep social distancing between the operators. And so my recommendation to the board is keep the policy suspended and decide how we restore fares, and perhaps do something that has less driver-passenger interaction before we do that. But that we need to engage the community to make those decisions. We had to acquire PPE and driver shields. As Justin mentioned, almost everybody in the state has done this, but there's also, you can't actually acquire them right now. There is a massive shortage of polycarbonate. We ordered our polycarbonate shields in the last week of March. We actually got delivery of them the third week of May. And we were lucky to get them at that. And there's still people waiting for the delivery of materials. So that's a real issue because everyone's asking. You know, every business in the area is looking for this material to go forward. Social distancing on the buses. We're a little tighter than King County is. Our full-size bus can carry 10. And that's because we have more 35-footers in our fleet, and that's what a 35-foot can hold at the same level, and we just apply it to the few 40s that we have in the fleet. But we also had a significant part of our fleet, which are cutaways that operate on fixed routes that weren't as busy. Those can carry 3 people because they have a lot less square footage inside them, and we've actually had to cancel all our cutaway service and take our used buses and put them back into service in order to maintain social distancing. And in some ways, we got lucky on this. We took delivery of 10 brand new buses March 15th. And so the buses I was retiring, I was able to keep them. And so we now are operating a lot larger buses. And one of the big political questions is it's telling the world a full bus is 10. It's, you know, that's what a full bus is today. And so stop thinking about empty buses running in neighborhoods. We can't use the small stuff. There are also costs because of that. So I'm keeping buses that are 16 years old and have 1.2 million miles on them in service. We'd actually been delayed almost 2 years in getting equipment because of waiting for better, for improvements in the electrical technology. The new buses are all electric, actually working quite well. One of the surprises. Then we had to have more security. And that may seem counterintuitive because we have a lot fewer passengers, but every social service agency shut down. So there was no place for the homeless to go except the bus station. The library's shut, the courthouse is shut, all the places that had Wi-Fi shut. We had to turn our Wi-Fi off because we were too attractive. And so even though there's not an increase in the number of homeless on the bus, there's a lot more at our stations because we're the only place open. And we had to close our building, partially for that and partially for social distancing, but they're around, so I have to have security more hours of the day just to make sure that things don't get out of hand. And that's been an issue. That as well as the police can no longer enforce trespassing rules because the jails have social distancing issues and they can't arrest anybody. So it's a vicious circle going forward. Next slide, please. So we cut service April 3rd by 35%. That was based on staff shortages. We had a bunch of people who were out because they thought they'd been exposed to COVID. We actually didn't have any real cases at that time, but we couldn't cover our shifts. And so we made a service cut based on that situation at the beginning of April. within 2 weeks, it was clear to us that we actually were in better shape from a staffing perspective. People wanted to come back. And we had social distancing issues starting to show up on our busiest routes. And so we did a 5% service restoration April 13th. We had another 15% on June 1st, and this is because we couldn't maintain social distancing on the buses at the lower level. And then July 6th, we did a 16% service addition. This actually was, we redesigned some of the urban routes in town. The fact that we actually redesigned something that normally takes a year to do in about 3 weeks is pretty amazing. We reduced the frequency of some of the routes that were lower ridership in order to make space available to do social distancing and also to do the Sunday expansion we had promised the public. We felt if we're going to spend the additional money, we need to get it out there. So we actually did expand service to 7 days a week, July 6th. And actually, we had our first Sunday last week, and we carried almost what we were projecting to do if we hadn't had COVID. We had almost 1,000 boardings, and we do, on a good day when we were peak, we do 4,000 boardings a day. So that was surprisingly effective. Next slide, please. For us, the financial impacts are really not that bad, but that is unique as heck. We had a new sales tax, so we had a 20% increase in funding coming in. Our federal CARES Act money, what the feds did was they gave us all 2.7 times our annual federal allocations was the formula they used going forward. Link is a beneficiary of what's called the Small Transit Intensive Cities program. It's an incentive program for high-performing small transit services, and we're one of 11 systems that get all 6 of the measures. That actually doubled our share. So we got a $7 million allocation on an $18 million budget. So we actually proportionally got a lot of federal money. That, and we'd also had saved almost $9 million over the last number of years to buy buses for this expansion we were supposed to be starting. And so we just didn't buy the buses. So in terms of revenue, we're okay. Unless the sales tax collapses by 35%, we told our board we can do the expansion we actually did, and we're okay for 5 years. But that is because we're going to spend all the reserves and spend all the money we have for the expansion. And that also has the sales tax bumping up again in 22 because it's planned to do that. That's why we have 5 years of thing there. That's unique. We're the only system in the state that has that circumstance because we were planning for an expansion. We are not doing the full service expansion. We ended up expanding net was 3% over where we had been prior to COVID. We did add some Saturday, we added our Sunday. So, I mean, it was to the public, it looks like we expanded service, but we actually cut parts of our base system that were probably not as productive to go forward on. We're having to delay the capital projects that were in the sales tax plan. Those are not going to happen anytime soon. And then my biggest fear is that we're going to have to reduce service again because of outbreaks. I have hired 25 new operators for the expansion. So as I had people pull back because they're high risk and not drive or retire early, and we had a bunch of that, I'm about staffed where I need to be today because I had that increase in staffing. Most of the systems in the state are telling us they don't have enough operators to operate their full schedules because of the loss of people that just can't drive because they're high risk. And so we're okay today, but if we have another round of this, and we're one of the counties that's heavily impacted, we're having record numbers of cases right now. We're having our ICU is full, so we're kind of worried this is going to be hitting us again, and we'll have to cut. And that's just a terrible way of operating service to keep going up and down as we're going forward. Next slide, please. So, as I said, it's an existential crisis. We have ridership losses. We have our fare revenue is gone. Our sales tax is down dramatically, and we have to do social distancing. We're a rural system. Our ridership was not terribly high to begin with, on all things considered. I mean, we're a very efficient rural system, but we don't have packed buses. For us, our performance is if we had 15 to 20 people on a bus, that was a full bus for us most of the time. So social distancing is something that I could handle more of because my buses weren't terribly full beforehand. So I haven't had to add as much service to maintain social distancing. But we are today starting to have to pass people up because of social distancing issues. And again, that creates that really lousy quality of service that we're trying to deliver out there to the public. And we're debating whether we're going to try to do more, use some of those cutaways that we've parked because they were too small for the day-to-day service to do some backup issues. We've had to increase our spending on cleaning and sanitation. We've had to purchase an amazing number of masks to give to our riders. We had a real issue with masking in our area in terms of there was a political statement to a great number of people. And so when the mask orders came down, there was a lot of folks who didn't have them, and trying to get people to use them has been a big issue. The CDC guidance a couple of weeks ago that said that employers should not allow their employees to use public transit is a gut punch for two reasons. One is it's a statement that we're not safe. The second part, though, is under our state's L&I regulations, if you have a health authority that's made this regulation that said that it's unsafe, you can no longer pay your employees pass costs. So my pass programs are all stopped. So my hospitals, my colleges, they can no longer buy passes for their employees because there's a health recommendation saying not to do that. And so that's a huge impact long term. Part of the reason I felt like, well, let's go ahead and keep the fare suspended. I can't use most of my pass programs because they can't legally pay for them now. And then rental income. So we have transit centers that have tenants in them. I've had to cut the rent for all of them because they can't stay in business. I don't want to lose the cafes and coffee shop and those things that we have in those facilities. So we've had to cut our rent, and inner city trailways, we had to cut their rent as well because their ridership is down actually more than ours is. And so again, trying to make our facilities work means we've had to pick up more of the costs and those things as well. Next slide, please. So that's where we were on that. Thank you. It really is, you have to maintain social distancing, which means you have to have more buses on the road in order to maintain ridership. And it's just, there's no way to get to it. How do you get the money to pay for it? How do you do on the backside? For us, we feel really lucky that we had done this expansion plan. We had the assets in place to go forward. And so the financial crisis isn't as big an issue for us. And since our ridership tended to be more transit dependent anyway, our numbers aren't quite as bad as what we're seeing out other places. But I also think it's going to be a harder fight for us to get back to the high numbers that we used to have, because the discretionary riders here, we don't have the traffic congestion issues you have in central Puget Sound. So until people feel totally confident the bus is a safe place, they're not going to get back on it. And if employers can't encourage it, and if the health recommendations are not to use transit, which is what they are, that's just a really, really hard place to go. And we put a lot of energy into trying to work with some of the studies that have been talking about the fact that you can actually have a closer social distancing on buses and masked, and there are almost no documented cases of any transmission of COVID on a bus. The impacts seem to be other places. It really is, based on the research, a safe environment, and we need to change those recommendations if we're ever going to recover in an effective fashion. Thank you.
Thank you, Richard. Our last presenter, and probably a little pinched for time, is Russ Arnold, and Russ is the Chief Customer Experience Officer for Sound Transit.
Thank you. We should be okay for time, and I hope to maybe be brief but thorough to allow for some time for questions. So I want to try to make sure I don't kind of go over some of the same things we've heard, because we're all in a very similar boat. We did a workshop internationally a couple weeks ago with LA Metro, MTA, PATH in Jersey, and Passport for London, and we all recognize we're pretty much in the in the same kind of area, trying to fix very similar things using the same tactics. So let me tell you where we're at. No presentation, so it'll be quicker maybe. So system-wide, we're down about 83%. So our light rail system is down about 84%. Our express bus service is down 80%. And then our heavy rail sounder service is down about 91%. And so when all of this began to hit us collectively, I think, we started pretty quickly with a monitoring system. So we started monitoring our services to see how we needed to adjust and if we could be nimble in adjusting those services to respond to what was going on with ridership. So we set up kind of 4 key phases or scenarios that helped guide us. So one was, how could we schedule for people to maintain social distancing? And so we started with that, recognizing that any of the scenarios I'm about to tell you, each individual route can be at a different point in the scenario. This isn't kind of system-wide because the system's not coming back at the same time. Routes aren't coming back at the same time. So once we, our next scenario is increased demand. So we know that we get to a point where demand increases and it negates our ability to allow passengers the opportunity to social distance. So that was kind of one of our next scenarios. How would we deploy safe and dependable service for our passengers when demand meant they couldn't social distance? Next was commute normalization, as we started to see either commuting come back to its normal pattern, or we saw signs that commutes were kind of normalizing in a different way than they had been before. How would we respond to service? And then our last area we call full service, but I think right now we're thinking that's 18 to 24 months away. And I don't think there's much science behind that as much as hopeful optimism that it's 18 to 24 months away before we're all back to kind of full service. So those were the things that we're using to guide us. Like I said, we have routes. We've collaborated with MBTA in Boston, and we've adopted one of their terms that they have durable routes. So routes that never really saw decreases. They were maybe still 90% ridership, no matter what was happening with the rest of the system. So we have some durable routes that are in the same place, as much as we have some routes that, from a ridership standpoint, have just kind of been decimated. And our system is not equal across all those things. So we started, as we were monitoring, we took a research approach. And our research approach started with trying to understand what passengers needed from us to remain confident using our system when they needed it, or to be confident to come back to using our system. So that's where our focus has been. How do we ensure passengers are confident using our transit system? And so we went out to find some answers from passengers. We did voice of the customer. It's still running right now from our customers, but then we also tried to coordinate with as many of our regional partners as I could. So Community Transit, King County Metro, Kitsap, I believe we've gotten some stuff from Pierce Transit. So everybody that's got some type of similar survey out there, research they're doing, we've been trying to pull it all together so that we can cross-tab all of it and get a comprehensive view of what passengers are wanting. From us, it's been interesting. The kind of top 3 things we're hearing so far from our primary research is that people want to ensure everyone's got a mask. They want to know what we're doing, so they want to know, interestingly enough, they want to know if someone that works for us is sick, are we telling them to stay home? That was kind of the responses. They weren't sure if we were doing that or not. So we recognized increasing communications about what we were doing and how we were keeping our employers safe, our employees safe, and helping keep our passengers safe was needed. And then the third top thing was they wanted hand sanitizer or sanitizing wipes. And so we think about a lot of this in very similar terms to security, right? There's kind of the things that will keep people healthy, and then there's things that people need for kind of psychological health, psychological confidence or safety. So we've been trying to break things up into those two buckets so that we can be smart about deploying our resources in the most manageable way and in a way that's sustainable and not kind of responding to something that maybe isn't backed with science. So we started there. We've also been reaching out to our employers that we have past program with to understand what they're doing with their employees, what they're wanting to hear from us in terms of coming back. And a lot of major employers in the Puget Sound area we're hearing are continuing telework through October, through the end of the year. These are past program participants that make up, they're the highest 10% of all passport users, so they make up a huge portion of our ridership. So if their employees are not coming back until end of the year, that has a dramatic impact on our ridership. And then we've been paying close attention because we do believe that a big litmus test for ridership for us is going to be what happens with schools. As Hannah pointed out, I'm lucky my children, I think, are outside or you'd be hearing them, but managing this world with that is challenging most days, and that will affect ridership as well if children remain at home and parents have to figure out how to juggle both. So we've been watching those. We've also been collaborating and looking for best practices. So we're doing research, we're pulling together what transit agencies across the country, as well as internationally, have been doing to respond to this, so we can get a sense of kind of what are the best practices out there that are really helping. Although I would say that most of the research indicates it's not much different than everything we've heard on this call today. And then we also are fortunate enough on our task force team, we have an industrial hygienist from Harvard who actually is co-authoring and co-authored, I'll get this right, APTA's Cleaning and Disinfecting Transit Vehicles and Facilities During a Contagious Virus Pandemic. So he co-authored that, so we're using him for a lot of this, and he helps model a lot of this. So what he tells us a lot is it is about mask coverings, face coverings in some way, and about airflow. So we've been analyzing a lot of airflow. We've been partnering with LA Metro. LA Metro has been looking at ways to change the airflow in their coaches or their trains to get more airflow. They're also piloting out some UV lighting inside the HVAC system to clean the air better, although the science isn't really back on does it work or not, but they're piloting out to see what the results are. So we've been partnering with them. So, I talked earlier about some guidance here. Our top priorities are if we can get to 100% of passengers and our employees wearing masks at all times while they're in the system. We think that is going to have huge impact. As I said, my industrial hygienist advocates that I try to make sure nobody speaks on transit. I told him that seems to be a pretty big lift, but he informs me constantly all the P's and T's offer particulates into the air, and that's a problem. So instead of going with all quiet coaches, we're trying to figure out how do we get to 100% face coverings. And right now, we've started to try to figure out how to collect that data. And so we're trying to use our fare enforcement people to spot audit that as they go through trains and whatnot. And we think we're at about 80% typically face covering. So we're encouraged by that. We want to do more. We've done some pilots on passing out masks. We initially thought we were going to do it almost as a reminder campaign. So we do it kind of in the morning peaks on the Mondays at high intermodal exchanges, high ridership parts where we could remind people, you have a mask? Nope, here's a mask for you. Don't forget to wear your mask all week long. And we're trying to think through how that would work and how we can operationalize that long term. So that's one of the things. So our increased cleaning protocol, so we're obviously following the guidance he wrote for APTA, but we also recognize the science says, I think it's like less than 0.1% chance of actually contracting from a surface. So we really are trying to balance that out. We increase our staff to wipe down TVMs, but that comes at a huge cost. And we're trying to figure out, does it actually have the benefit, or is it in the other camp of it's a psychological benefit for our riders? And so we need to do it to kind of continue to make sure that they are, again, confident using our system. So we continue to measure that. and then opportunities to increase airflow, filtration, or even pilot out UV lights. We're looking at that, although most of this is as most transit is a pretty big balancing game, right? So we can figure out how to get more airflow on the train. It's a giant engineering undertaking to reconfigure the entire HVAC system on a train, especially when we have brand new ones coming in and they aren't even in operations yet, and then we're going to tear up the HVAC system. And it might not prove beneficial in the long run. It might be beneficial for right now. What we do know about the trains is all the modeling that our industrial hygienist does indicates that it's safer to be in the train because the airflow is better than to be like in an office building. So better airflow there. He tells us constantly on buses, if you just opened up some windows, you'd be 100% great. We also know balancing out people's comfort, how well the HVAC system works, that's something else. And he's going to start modeling out best way recommendations to increase airflow in buses so we can look at what to do there. So that's kind of what we're doing on kind of the science side. The other priorities are we're looking at exposing passenger loads by route and time of day. So if we can give people the information and they have the ability to move slightly when they travel and travel less congested times, we believe that sets them up for success, and we want to give them those tools to set them up for success. We want to increase passenger communication, so not just reminding them to stay 6 feet apart, even though we know that that's going to diminish over time. I think the science indicates with a face covering, it can go down to about 3 feet apart. But again, you know, that's why we're, instead of focusing on social distancing as much, because we know demand will eclipse our ability to do it, we're trying to focus on the face coverings at 100%. But that increased information to our passengers, we believe is vital to make sure that they have what they need to make smart decisions about their travel when they can. And then, again, we're going to continue, like I said, we have some routes that people will be able to social distance for quite a while because the demand's just not there. We'll continue to plan service and deliver service that continue to give them those opportunities. But when that eclipses, we'll have to figure out the best way to deliver service. And then hand sanitizer availability. It's a little bit of a, trying to understand how to do it has been challenging. We get a lot of feedback from our friends in the fire department that if it's too large, it's flammable, it's basically a potential bomb that's sitting there. And so they're okay, like really small ones, but then we've analyzed it and it's worth about 1,000 pumps in a day, which means when you're averaging about 23,000 link riders, it's good for like the first half hour of the day, and then you might as well take it down. So we're trying to figure out how we can do that. We know that if we offered everybody sanitizing wipes, right, then we get in the other side of we don't have good receptacles everywhere. What do they do with them when they're done? How does that affect, you know, the cleanliness of our coaches, which is a, you know, foundational thing for how positive your experience is using not just transit, but probably anything. So we're trying to measure those things out. And so that's kind of where we're at. We're trying to figure out how to make smart decisions in terms of how do we keep our customers safe and how we give them the information to keep themselves safe. That way, when they need us, we're there for them and they can continue to use us. We have all the same challenges that everybody else mentioned here, revenue shortfalls, you know, lack of available operators to be able to run our service. We're all challenged with that. So our focus right now is really on our passengers and giving them what they need. So with that, I'll try to give 12 minutes. So in case there are questions, everyone here can engage. And I want to thank you for the opportunity to speak and be part of this panel, and thank my other panelists for the information. I've learned a lot today.